Doctors of Reddit, what do you do when you see a patient is obviously faking it? Doctor here. Fakers are difficult to handle. Adult fakers are usually quite sad affairs, and there is really no satisfaction in exposing them. One story is a young guy in my town who has a weird and unexplained addiction for getting a cast. Not having one, getting one. He has come into different years claiming an injury, but there are never any objective finds. Then he usually gets a cast. Since he is in pain, he gets one for pain relief, and then comes in multiple times because he got his cast wet, the cast hurts and so on, and gets another one. He has done this so many times that he is now well known by most staff and doctors in the area. I met him once, and since I hadn't looked at his patient history beforehand, I believed him and sent him to the relevant examinations. And even if I did know his history, it would be wrong of me not to trust him, because this time the injury might just be real. It's more important for me to protect my butt, even if it means that some extra work is done for nothing. And in my country this guy doesn't pay the actual costs of having these x-rays and ultrasounds. TLDR. Some people fake it, but since you have more to lose by exposing them, you usually just try to be professional and move on to the next patient. You should use him to train new doctors to put casts on. You could even tell him that you know he's faking it, but it's okay. Some guys could use the training anyway. As a doctor, never doubt your patient until you can prove him wrong. He wants to feel better in some way. Look up WHO's definition of health. I worked in a public hospital where sodium solution was prescribed to patients that were suspected of faking catatonism. That crap hurts as heck. Hypertonic solution in muscle. Instead, I did something more humane. I gave her crisis anxiolytics and referred her to a psychiatrist. It normally turned out they were left by the guy that left her pregnant with a second child while she comes from a low-income house with no studies. That hurts more than your average headache. As a doctor you have to understand something. People that fake diseases either feel the disease, or need the break from their world and can't handle their stress properly. Both type of people are sick people and need a psychiatrist, not a man up. At least they need a good heartfelt talking, some empathy. Maybe you even save one or two from the brink of suicide. Even kids that call in sick too often must be running away from something they perceive as humongous and dreadful. And besides, you always have to clear up every physiological and functional pathology before even thinking about psychiatric and emotional problem. What if that person is complaining about a feet and headache because of a tumor? Care for your patient's life as much as can, holistically, because they trust you blindly as someone that will make them feel better. Do your work and you'll avoid ethical, remorse and legal issues. Freaking be nice. As someone who used to fake being sick often when I was a child to escape school bullying, I'd just like to say thank you for being one of those doctors who is understanding and not cynical. We get a lot of training for this in school for audiology. People fake hearing loss all the time to get workers' comp or money from the government for service-related hearing loss. Here's the thing, we can always tell. There are only a few specific ways, like the way you hear through air conduction, when the sound has to go all the way through your outer and middle ears before reaching the cochlea, and bone conduction, when vibration of your skull sends the sound straight to your cochlea, can interact. People who are faking tend to pretend their hearing loss is flat across all the frequencies. If someone is pretending to have hearing loss on one side only, there is even a special test called the stinger that we can do. Basically you play sounds in both ears but the brain only perceives the louder sound. So as soon as the sound in the person's bad ear gets louder than the other ear, they stop responding. We're trained not to ever let on that we know the person is faking. We blame it on the equipment. We move to a new sound booth. We tell the person that the test results just aren't matching up and we should have them come back another day. Basically you give the person every chance to tell the truth. If they never admit to the fact that they are faking, we can run a test that measures brain waves in response to sound and prove their approximate thresholds that way. However, some people have psychosomatic hearing loss, where they truly believe they cannot hear even though they physiologically can. In kids this can be caused by trauma or abuse. So even if we really think a kid is faking, we would never tell their parents that in case it meant additional abuse for the kid. There is a point at which we bring in social workers, psychologists, etc. Former paramedic, fake seizure, oh my, it's too unsafe to move them like this. We'll have to put in a catheter first, and wouldn't you know it, a miracle. I'm a doctor, but as a pathologist I don't have to deal with malingerers directly anymore. I just get to do their autopsies and say, well, I guess they weren't faking this time. I have a friend that's a pathologist. He jokes I feel that I'm a terrible doctor. My patients never make a full recovery. I laughed. Doctors don't need to be funny. I knew a kid who was in a therapeutic wilderness program and faked a rattlesnake bite by poking 2 holes in his hand with a cactus needle. The guides bought it and he had to be evacuated by helicopter. The doctor gave him anti-venom and could obviously tell the kid was faking it. This butthole ended up costing his parents $50,000 over nothing. His parents should have made him pay it back. I'm an EMS pilot and the nurses medics have shown me a couple of awesome tricks they use on fakers. When they are sure a person is faking that they are unconscious, they will lift the person's hand up over their head and let it go. The fakers won't let the hand flop down directly onto their face. If they're out for real, it'll go straight down. Another fun one to watch is when a person's faking a seizure. The nurse will announce loudly that they are going to start an IV on a specific arm. It's funny to watch somebody faking a seizure with 3 limbs moving instead of 4. Till that medical professionals play why are you hitting yourself with patients. When I was young I used to get sick on a fairly regular basis. The majority of the time I could tell my doctor thought I was faking it. Luckily, my grandpa was a doctor and my family believed me, so they'd keep pressing on. At one point, my doctor diagnosed me with fibromyalgia, which I know is a thing, but pee me off to no end. My family thought that was probably it though and let it rest. They gave me painkillers and while that did take care of pain, it didn't stop me from getting sick. Strep throat, sinus infections, etc. Halfway through college I get a new doctor and she recommends looking at my blood sugar levels. It turns out, that was my problem. Reactive hypoglycemia had my insulin rising and falling at inappropriate times and had seriously fricked with my immune system. I changed my diet and guess what? I rarely get sick now. This is a really interesting thing the doc picked up on. I think blood sugar levels should be checked at everyone's yearly physical or maybe 2x per year for all. I'm guessing tons of people have diabetes or hypoglycemia and have no idea. Last Christmas I had meningitis. I went to the hospital twice and they thought I was faking. The first time I went in complaining of severe head pain. No fever. Sensitive to light. Couldn't move my neck. They gave me ibuprofen and turfed me home. The second time I went in several days later I had a fever. Was throwing up. Still sensitive to light. Crying from so much pain. They essentially treated me like I was faking for hours. And tried to send me home. When I begged them not to, the doctor told me, well, if you want to stay then procedure is to give you a lumbar puncture and a CT scan. Those are very expensive. You sure you want to stay? After she gave me the lumbar puncture I think she figured out I wasn't faking. Buttholes. Not a doctor, but once when I was a kid, my doctor knew I was faking sick to get out of school. So he told me he thinks there's a problem with my sex organs. I was faking the flu and asked me to take my pants off. I immediately felt better. Buggery avoided. As a paramedic, I have been known to fake the faker. I had a girl in my district that would fake seizures all the time. I'd usually put normal saline in a nebulizer and fog up the back of the ambulance while telling my partner that the anti-seizure mist was on and she should be all better soon. Funny how she woke right up every time. Chart reads, when asked PT what was wrong, PT stated, I'm having a seizure. Paramedic flight paramedic. I'm one of the weird ones. Unless someone is obviously drug seeking, I tend to treat what the patient tells me, not my impression of their situation. I'm talking specifically about pain here. Our medical community has been trending towards demonizing narcotic pain control, and I think that's one of our biggest shortcomings. Adequate pain control improves so many things. Patient compliance, recovery rates, etc. If someone tells me they're in a lot of pain, I generally believe them and treat accordingly. Percocet, T3, Dilaudid, morphine. These are medicines, people. As a paramedic, I would think your job is to treat what the patient says and not worry about if they have ulterior motives. Leave it to the doctors to sort out that Mrs. So-and-so is just looking for more Vicodin. It's not worth risking a patient being in an undue amount of pain. I always worry that when I go to talk to the doctors about my depression they won't believe me, and it's kind of hard to prove how things go on in your head and how you can be fine one minute and be terrible the next. Ever since I was little I was getting terrible headaches that only got worse. Every time I went to the doctor he would pretty much roll his eyes at me, tell me to take some ibuprofen and just go back to school. They progressively got worse, and I mean worse, like the equivalent of a migraine times 10. One night it was so bad that I had to go to the hospital because I was puking from the pain. Turns out I had a malformation in my neck brain spine that required 3 brain surgeries to fix. Frick doctors that assume patients are faking it. Do your job. I had flu-like symptoms for just under a week and was sleeping a lot. One afternoon I woke up from a nap and couldn't move. I felt like I was being stabbed in the side. I started screaming for my family. I was in grade 6 at the time. My dad comes running and has to carry me to the car to take me to the hospital. I was crying and gagging from the pain every time my body moved. They admit me and run all sorts of tests. They think it's appendicitis, so they do an ultrasound but find nothing. I'm in the hospital for just over a week. I'm not allowed to eat anything, just allowed to drink flat ginger ale. After a few days, I'm not feeling any pain. Jacked on meds I'm sure. There was a classroom in the children's ward, so after coming back from doing some work my school sent, a doctor comes by to see me. He sits on the corner of the bed and informs my mom and I that he thinks I should go home. I'm looking better, feeling no more pain. I cry and tell him no, something is wrong. I'm not feeling any more pain, but I just know something isn't right. I'll never forget that feeling of just knowing something is wrong but can't describe it. He clearly thinks I'm faking it. Sure enough, he takes my mom out in the hall and I hear him tell her he thinks I'm exaggerating and if anything changes at home, to bring me back. When he comes back in, I lose it and refuse. I know something is wrong and this idiot is refusing to listen to me. My mom looks at me and says she trusts me and asks him to reconsider. He leaves and about 2 hours later comes back and gives in. He says fine, stay another night. He'll order another ultrasound the next day to make sure, but if it comes back with nothing, I'm going home. So the next afternoon, I go in for an ultrasound, and guess what they found? My ready to burst appendix. I was in surgery later that night. I agree, that took a lot of nerve to stand up to a doctor. Also, I teared up at your mother's reaction of trusting you. I hope I am like that with my own son. A couple years after my concussion traumatic brain injury, my mother informed me that when the paramedics arrived after I was hit in the head, the paramedic was almost 100% certain it was no big deal because I was just a 7th grader faking it or freaking out for smoking weed for the first time. Shouldn't paramedics give their patient the benefit of the doubt regardless, especially when sometimes they can clearly be wrong? Critical care physician. Depends on the situation. Pseudoseizure, splash water on their eyes, or, if you're meaner, apply nail bed pressure. Fake blindness. Some recommend confrontation, basically waving threatening objects close to the face. One ED doc I know even recommended going at them with a needle. This seems as if it could become self-fulfilling. More subtle approach. Several signs with letters and pictures. Ask if the patient can see each one. Last sign features something obscene about their mother. Watch for change in facial expression. Everything else, there's a whole body of literature about symptom validity tests. General idea. We can predict how a disease will act and how it won't act. We know this better than the patient. If the patient has a disease, the disease will quickly teach him what he should be feeling and not feeling. If he's faking, it's tough to figure out the right set of symptoms on the fly. Unfortunately, we as physicians don't really know that much and don't read too often, and so we often don't know either. And then patients end up getting their drugs and going home, which is what everyone wanted in the first place anyway. Intellectual purity is not our strong point. I work with teenagers. We once had a girl that did this all the freaking time, to the point of being pathological about it. She was complaining of stomach pains and they kept her in the hospital running a ton of tests, more than once. You could tell the nurse knew she was faking, but I think for legal reasons they couldn't dismiss her without a diagnosis. But the absolute best was when she was army crawling across the dorm floor because she claimed she was paralyzed from the knees down. Not a doctor, but had my own encounter with one that basically told me to suck it up. I was visiting a psychologist after a suicide attempt and years of depression under my belt. I finally decided to get help and he told me, and I quote, "Because it's burnt into my brain, you're crying over spilled milk." He refused to diagnose me or prescribe me anything. I haven't seen a doctor since out of fear that they will say the same thing and still suffer under my depression. Frick that guy. I encourage you to seek help once again. Look for a cognitive therapist. When I was a young teenager I had developed this crippling pain in my stomach. One time I was in there being treated and the doctor performed a bunch of standard tests on me. Blood, urine, CAT scan. They couldn't seem to find what was wrong even though I was doubled over in tears. Then came a shift change. Dr. A explains everything that's been going on to Dr. B who will be taking over. Now they were standing right outside my room and I could overhear them and DRB suggest that I'm faking it for attention from my parents. Needless to say he discharged me shortly after. For years I suffered from these pains until one day at 25 I had a doctor who decided to actually do her dang job and tested my gallbladder function. And miraculously that was the problem. Instead of releasing bile to aid digestion like a normal gallbladder, mine just had a seizure pretty much, and this caused all sorts of pain and other symptoms I was experiencing, and the simple fix was to just remove the offending organ. In short, frick that doctor that doubted me. TLDR. Doctor thought I was faking stomach pain. Turns out I had gallbladder dyskinesia. Before my grandmother died 2 years ago, paramedics diagnosed her as faking illness and said she was fine. My grandmother was seriously one of the toughest people I have ever known. The very fact that she was having to complain about the way she felt was enough for me to call. She was dizzy, couldn't stand up, and was vomiting. The paramedics came in and said she was fine. I asked if they could take her in as a precaution, but they were hesitant, saying she was fine, but had high blood pressure. She had been slurring her words, couldn't form a very good sentence, and seemed disoriented. They chalked it up to high blood pressure. I said it didn't really seem like high blood pressure, and they took her in eventually, costing us a valuable 20 minutes after an argument, and me offering to drive her to the hospital myself. She had a stroke, and wasn't ever the same. She died 2 months later, never having left the hospital. One time I faked being sick for the day. My dad took me to the doctor and they said I had wheezing in my chest. Sure enough, I got sick as frick the next day. I was in 6th grade. One day when I was 17 I woke up with excruciating back pain. It got so bad I could barely walk. My parents just gave me some Advil and sent to school. My dad said it would work. My dad gets really bad back pain because of a car accident many years beforehand, so he thinks he knows. So I get to school, and surprise, Advil doesn't do nothing. I go home that night and I run a fever of 104, and I start to throw up. My parents finally think it's not just back pain and we go to the doctor the next day. He also agrees it's just back pain and I'm sick because of something I ate. He prescribes me T3s knowing I'm allergic to codeine. I didn't know codeine was in T3s. Anyways, the back pain goes numb but I get more sick due to the codeine. Fast forward 48 hours and I still can't keep anything down. I go to emergency where I'm told to stop taking the T3s and tells me to buy a pad heater for my back. He also gives me IV fluids because I literally haven't eaten in almost 3 days. Anyways, the nausea stops. The back gradually goes away. It came back every once in a while but I took Advil for the pain. Fast forward 3 years later I develop other odd symptoms and my nurse practitioner sends me for an ultrasound of my bladder, kidneys, stomach, ect. Turns out there was a huge mass on my kidney and I had cancer. I'm still weary of doctors to the day. Depends how you define sick. Kid who refused to bear weight on his leg after a fall but otherwise wasn't complaining. Do 2 physical exams, a regular one, where they cry if you get close to it, and another one where you distract them. Sure enough, when he was playing with bubbles he didn't notice me touching his leg. Adults faking for pain meds, that's a bit more difficult. Emergency docs have to deal with this a lot. Being distracted actually helps with pain a lot. I had to get liquid removed from a cyst on my wrist before. I was looking away, and when he would stick the big needle in it he wouldn't tell me, but then he would lightly touch it and tell me he was sticking the needle in. I always cringed when he was sticking the needle in. It's all about psychology. The thing I hate about ever going to the doctor is I feel like I have to prove my case. It's probably just my hang up, but even with an obvious broken bone arm or severe sinus infection, I'm always hoping they'll believe me. X-ray came back with fracture? Yes. Ha. See. My husband is a paramedic and the worst story of faking it I heard was a girl who lived 20 minutes away had an ectopic pregnancy. An ectopic pregnancy is where the egg was fertilized outside of the uterus, like in the fallopian tube. Now in this case it's very painful. By 9 weeks you have to have surgery to remove or possibly die. So the girl called and said that she had an ectopic pregnancy and she was 20 weeks along. My husband in the ambulance goes down there and pick her up. He knows it's spools but he is still required to give her a ride. So she walks over and hops in. Then her tweaky looking boyfriend comes over and tries to get in. At that point my husband stated that he couldn't get into the ambulance. The girl starts throwing a fit saying he's the father of her baby and needs to come. My husband says I'm legally required to take you to the hospital. I'm not legally required to take anyone else. So he is not coming. She says oh well I feel better then and guess I won't need to go to the hospital anymore. My husband said the guy looked strung out as all heck and didn't want to get attacked in the ambulance. As a former faker of strep throat, they know. They always know. My mother is in school to be a nurse. I've had knee problems for a few years since I was 13. I'm 18 now. I went on a summer tour with a group that required the physical equivalent of the US military. Think extreme physical training and stress. Doing these physical things for 12 hours a day, every day for 3 months, with 5 hours of sleep. Came back barely able to walk. Was told I was too young to have knee problems by my mother so was never taken to the doctor. Also thought I broke my foot that season. Got told you weren't able to move you'd be in so much pain. Not taken for that either. My depression was just teenage angst and a cry for attention. My suicide attempt was a selfish attention scam. After I moved out, I finally went to doctors on my own. I wasn't given insurance information or anything from my parents when I went, so my boyfriend and I paid out of our own pockets. Tendonitis in both knees, broken foot that had healed improperly, and a cyclothymia diagnosis. I hope my mother doesn't have that faking attitude with her future patients. I understand there are bullshitters out here, but if they hadn't just assumed I was too young or whatever else, I would have been saved a lot of pain and money. You're an abused child, not an abused patient. I'm sorry, though. When I was 13 I began having weird symptoms of dry heaving due to extreme waves of nausea and fainting due to the same extreme nausea. After I missed an entire month of school and had to transfer to another, I was at my new school one day in the bathroom when everything went black. I have foggy memories of being in an ambulance and having been told the fire department had to come and saw off the bathroom lock to get me after someone had heard a loud thump and no response. Anyway, I clearly remember waking up in the ER, where I was hooked up to IVs and apparently had a tox screen run. The doctor comes in and starts mouthing off to me about how I'm a junkie pot smoker and I'm just pulling all this crap for attention. My mother starts arguing with him, saying I'm a good kid and would never do drugs, especially since I was the one babysitting my kid's sister when the cops called and said they'd arrested my brother at a concert with weed. Just a few months before this incident, the doctor proceeds to tell her that I'm a no good lying teenage brat and that I can't be trusted, as I'm sitting there confused as frick bawling my eyes out. My mom starts doubting me and calls up my brother to see if he had seen me use or given me any drugs. And I ripped the phone out of her hand and screamed at my brother, "Did you slip me some of that pot into my Cheerios this morning? I don't do pot, so did you slip me some?" My mother, seeing that I had no dang clue as to how marijuana works, hung up the phone and demanded that the doctor read the tox screen. Sure enough, there were no drugs in my system, and the previous screening had somehow been botched and caused a false positive. Looking back, even if I had been using drugs, that doctor had no freaking right to treat me the way he did, as if I were subhuman. Thankfully the underlying situation that caused the problems in the first place was discovered and treated, but I'll never forget that shitbag. I hope he pulled that crap with someone else and was sued for malpractice. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.